The reason I came into Utah Spine and Disc to see Dr. Metters was probably about March of last year. I lifted something I probably shouldn't have been lifting, and as soon as I'd lifted it really high and then kind of twisted a little bit, I felt radiating pain in the front left quad. I knew then, because I'd had prior ruptured discs, that I had herniated a disc. So I actually went and got epidural injections, and it helped settle down a little bit. Then I had some facet injections, and talking to the anesthesiologist, you know, we were kind of at the point where something else needed to really take place. So my chart was sent up to a neurosurgeon to take a look at, and they thought that possibly there could be some help there. And over the weekend, I happened to be reading the newspaper, and I saw an ad with Dr. Metters in there, and I thought, well, I'm going to give this a try before surgery. So I came in for a consult, and I talked to him, and he says, you know, I think we may be able to help you out. He did a little evaluation, and so I started therapy, and lo and behold, I was able to avoid surgery. So here I am. I'm Kevin Gray, and the pain I had been experiencing is gone. He took a look at my MRIs and took a look at things and kind of did a little evaluation, and he thought, oh, let's give this a try. And it was interesting because the spinal decompression is what I came in here for, and we talked a lot about that, and we tried some different things. You know, the first couple things, the first few times we did it didn't seem to do a whole lot, but then I noticed it did start doing stuff. But about 2-week mark, we tried a different position where we flipped me over on my stomach, and we kind of put the legs up and put the head up, or so I'm kind of in almost a banana shape, reverse hammock shape, and we started to pull that way, and I noticed immediately the next day that the pain had reduced. So we continued on in that particular position, and lo and behold, we followed through with that therapy, and the pain is gone. The laser is kind of a warm feeling. You know, it's kind of almost like a deep warmth that you help to heal the tissue. You know, and that was part of the therapy. So you'd come in, you get spinal decompression, you get the laser therapy, and then you'd get some an adjustment if you needed one from the chiropractors that were here. And I mean, it was a nice little step therapy that you went through. Well, my disc, I had a herniated disc, so it was pretty hot, and I was pretty inflamed, and I had been suffering some pretty bad pain that had progressively gotten worse. For me, the pain really started to subside at about the 2-week mark. It was through that time frame that it continually got better. Well, I had been in pain probably about 8-9 months, and it progressively got worse, and that's why I went to seek help. There was a point where I really couldn't walk very good. You know, and after 2 to 3 months of therapy, the pain really had subsided quite a bit. So it started to resolve. In comparison to being in pain that long, to going through the therapy, it was a nice resolution. Yeah, I think when it comes to chiropractic, there's different methods out there, and you know, I think this was a nice combination because it's kind of a setup thing where you come in, you know what your therapy is going to be, and it's a consistent therapy. And the spinal decompression combined with the laser, I think really did help me tremendously. You know, I think I looked forward to that spinal decompression on my visits when I was supposed to come in, because I knew if I continued with it, because I had started to see results, and I think the results were going to continue to get better and better, and they did. As far as professionalism, I think that the office is run very well. I mean, they know you by your name, which is quite nice. They tend to try to get to know their patients. They take care of every need that you have. I mean, they're asking you about your pain level. They want to know, you know, is there improvement, is there not improvement? If there isn't, they want you to see the doctor before you start decompression. They want you to have another evaluation. And so I think there's a lot of care taken in as far as it comes to patients and really what the patient's individual needs are. Spinal decompression worked for me. Whether it works for somebody else or not, I was at the point where it was surgery or spinal decompression, and I chose the spinal decompression route, which I'm glad I did. And I think surgery helps many people, but for me, I wanted that as a last option, and spinal decompression was able to provide me to not have to go through that. And so if you're up against a wall and you have an option, why not try spinal decompression? I did, and it worked for me. It's interesting to hear about a laser. You know, the only thing I've ever heard laser for is surgery and such. So I did a little bit of research on the laser, and I mean, the theory behind it seems really good. So I know that when they were using the laser on me, I felt a warm feeling, and so I'm hoping the process that that they said would occur occurred. My guess is it is, because I continue to get better over time. Yeah, I'm typically a pretty skeptical person. I wouldn't say skeptical. I like to kind of understand things before I get them as far as treatment goes. So I do a little bit of research and do a little bit of reading, and so I kind of got on the internet and researched spinal decompression a little bit and read mixed reports on it, but there were some really positive reports on it, and I thought, you know what, maybe this isn't for everybody. everybody, but it may help for me. And kind of the same thing with the laser. I did a little bit of research on the cold laser to try to find out a little bit about what the mechanism of action was on this laser to see if it really had some applicable properties to it that would really help me. Would I do decompression again? Absolutely. You know, the other thing that part of the process was not only do they do just adjustments, but they kind of teach you, Dr. Metters was teaching me some stretches and things that I could do to help loosen up some of those muscles that were all tightened up due to that inflammation in the disc. Well, as far as the overall experience, it was very positive for me. I mean, it did take a little bit of time to start to feel the resolution of symptoms, and he has multiple chiropractors here that would help with you. And when it gets really busy in here, it's nice to have multiple doctors in here to be able to work with. But the overall experience was positive in my mind.